and today we're going to be talking about metoprolol. Metoprolol is a beta blocker which comes in two forms, Lepressor and Toprolol XL. Toprolol XL is in an extended release form, which means it lasts longer and you will most likely only need to take that twice a day. Lepressor is in a standard capsule, so it doesn't last as long and you will most likely need to take that twice a day. The way a beta blocker works is it works by relaxing the blood vessels and slowing the heart rate, therefore lowering the blood pressure.
This medication has various uses. As we know, they are all related to the heart. As it was previously mentioned, this medication is a beta blocker. This medication is used for hypertension. It is used to prevent heart attacks, to prevent heart failure, and to prevent chest pains. There are two types of release forms for this medication, one being the standard release form and the other being the extended release form, like Metoprolol XL. The extended release forms are made with the purpose for the drug to be released at a slower rate in order to maintain a constant drug concentration for a specific period of time, which would minimize the result of side effects. The most common route for this medication is oral. Depending on the diagnosis, these would be the dosages as followed. For hypertension, for the standard release would be from 100 to 450 milligrams per day. For this extended release would be 100 to 400 milligrams per day. In order to prevent chest pains, you would prescribe 100 milligrams a day, but can be increased if needed. You could also take an extended release, which would be 100 to 400 milligrams a day max. For heart failure, class 2, you would take 25 milligrams per day for 2 weeks. For heart failure, class 3, you would take 12.5 milligrams per day. For the prevention of a heart attack, you would start the patient with IV and start them with 5 milligrams every 2 minutes for 3 doses. Then after, to keep maintenance, you would prescribe the patient 50 to 100 milligrams a day to keep it maintained, to make sure you prevent that heart attack. Because of the side effects of this medication, there are precautions that must be taken for certain diseases. For example, for the lungs, you want to take precautions with patients who have COPD. For the heart, you would want to take precautions with patients who have coronary artery diseases. You would also want to take precautions with patients who have had a stroke, patients who had thyroid problems, kidney problems, liver problems, also patients who have asthma, and also for precautions for, of course, geriatric patients and patients who have diabetes. As previously stated, this medication slows down your heart. So there is some contraindications that must be considered, like one being if the patient already has bradycardia. And another obvious contraindication would be if the patient is allergic to beta blockers.
As we all know, medications come with different side effects, and I will be teaching you some of those side effects to look out for and some side effects that are able to be more tolerable and if they need medical attention. Some of these side effects include bradycardia, which is slow heart rate, pulmonary or peripheral edema, so swelling in your extremities, cardiac arrest, chest pain, or fatigue. Some side effects of metoprolol that occur usually don't need medical attention, and one of those being fatigue. Fatigue is often seen with this medication because it does work by slowing down the heart. Therefore, you are going to feel more tired because your heart isn't pumping as usual. It is seem to be normal to feel fatigue, so if it's tolerable, take the medication, and this should be taken until the body gets adjusted to this side effect, and it usually does. If it does not go away, then you would have to let your physician know. This medication is also a high alert medication, and it has a black box warning, which essentially means that if this medication is stopped abruptly, it can lead to a heart attack. So leading to discontinuing this medication, we would like to taper off the dosage within 7 to 14 days before stopping the medication completely. And this would be done with your physician, and he or she would instruct how the dosage would be tapered off. Since this medication is used for hypertension, this can lead to hypotension, which is low blood pressure. Knowing the signs and symptoms of hypotension is essential while taking this medication because it does cause dizziness, which can lead to falls. So when taking this medication, make sure that you know how you're feeling when getting up. Be aware of your surroundings. Also, it can cause shortness of breath, difficulty breathing, or a night cough. And if any of these symptoms occur, to make sure you bring that up with your physician. Maybe the medication may need to be changed. Also, you need to be able to take this medication with food to avoid GI upset. And lastly, if the patient is diabetic, to make sure that they are checking the blood glucose levels closely.
So remember, metoprolol is taken for antihypertensive use, which is high blood pressure, as well as to prevent heart attacks.
And remember, this medication is for hypertension. Therefore, you should look out for signs of hypotension, dizziness, and to avoid hazardous activities if dizziness is one of the symptoms. Also, fatigue is one of the side effects, but allow the medication to work and allow your body to get used to the medication.
And remember, only 400 milligrams a day max.
And don't stop abruptly. Has a beta blocker function, which means that a little bit. Yeah.
This medication has different uses.
Medication to I don't know what I was doing. I forgot.
You just saying side effects.
Where are
Get it?
you?
Oh, sorry. There it is.